from your first year to your third year, what skills have you learned? Because you know how this saying goes that you learn on the job. Do you actually believe that from your first year to your third year, now that you are going into what you're going to do you believe that you've actually gained certain skills that will be useful on the job?
Hello people and welcome to JWK Journey with Karen. This is the continuation of Let's Talk Cardiac Physiology with Nettie. Hope you guys enjoy it, and I'm going to leave the link down below to the first one. So let's zoom into the video.
Prior to you going to the university, to you starting this course, you were excited. What was your perception about the course? What did you think it was going to be like? Did you think it was going to be hard? Did you think it was going to be more lab-based, clinical-based? So what were your expectations and were they met?
I actually thought it was going to be intense. I was 100% about this because the stress I went through in college, I actually thought it was going to be the same, but actually uni wasn't like that. It wasn't. I felt like uni was more of you have to be organized, you have to know what you have to do at the right time. Once you plan it, you can have fun and enjoy your time at uni. Because these lectures, they give you your tasks, they put the work online like a week before, days before, and you already know you've got a calendar for the whole year sometimes. So you can move ahead with your work and then just sit in the lecture room and then upgrade yourself and do you know what I mean? Plan it.
Guys, I'm taking this advice too because we are all struggling in this life. But I feel like maybe she's just saying this because she's mastered herself. She's done with the 3 years, guys. So obviously, if she looks back, she's gonna say, "Oh, I did a great job," but it's gonna look easier compared to the headers that she's about to overtake now. That's what she's saying this, but it is what it is, isn't it? What were the difficulties that you encountered during this course and how you overcame them?
Major difficulties were essay writing. Like I'm not English.
Yeah.
And
I struggle with essay writing.
Yeah. Translating words from literally
Italian.
word by word from Italian to English is completely different if you start doing that way. So what I learned was that I have to think in English to write in English. If I'm speaking Italian, I have to think in Italian and write in Italian. That's the approach I took.
I feel like these are challenges that most Italian students do face.
Yeah. Possibly, I think it's everyone who's not of English background. They'll be struggling with some writing skills, some sort of writing skills. But what I understood is that writing essay is not just the grammar. The lecturers wouldn't really care about your grammar if it's not changing the meaning of what you're trying to write. And they are more interested in critical writing and how you portray your information across.
From your first year to your third year, what skills have you learned? Because you know how this saying goes that you learn on the job. Do you actually believe that from your first year to your third year, now that you are going into what you're going to do you believe that you've actually gained certain skills that will be useful on the job?
I would say through my placement I've gained technical skills, which are sufficient for my level I am now.
So would you say that from the theoretical things that you've learned from your first year to third year, is there anything that you know for sure that these things I have it at the tip of my hand? The things that you've learned that you know that if you go on the job, even without them telling you what to do, you know what to do because you've done it.
ECGs, interpretation, analysis, and performing them as well, and also reading graphs for in the cath labs. ECGs, it goes with the graphs as well. So they are the pressure waveforms. I can read those as well. These are skills that I feel like I can't forget anymore. It's like riding a bicycle. Literally, you never forget it's ECG. Yeah, there are things that obviously I can't even be qualified for like 3 years here, but if I'm not trained in that aspect, in that particular thing, it's no point. I still can't do it. Even if I'm I've got a degree in that and I haven't practiced it, it's no point. So something that I can say I can do independently is interpreting ECGs. I won't say all the diseases, all the cardiovascular diseases, but major.
Just looking at you can tell, oh, you have headache.
Yeah. no, not that. But if I read the rhythm, I'm able to tell you what rhythm it is and analyze all the waveforms. And
give us example of rhythms.
Well,
read my
basics. Oh, I can't do that without an ECG. I can't do that. Okay, I need a machine, guys.
Example of rhythms.
The sinus rhythm is the normal rhythm. We've got there are other complex ones that are due to congenital diseases and also due to acquired diseases such as sixth sinus syndrome, where your sinus node stops functioning properly, so it can lead to loss of consciousness, where you can end up collapsing or like. There are a lot. If I'm to talk about them, trust me, I won't finish. I took a whole year to learn the different diseases. Do you get what I mean? My second year, that's what I did. I learned most of the cardiac diseases, and so each rhythm is associated to a particular disease. And some rhythm can be both diseases. So that's where our interpretation comes in, where we have to figure out, because the treatment for that particular disease changes. So if you've got, for example, sixth sinus syndrome, and I think it's issues with your AV node, for example, your management have to change, because we will have to put a pacemaker, or we'll have to maybe put you on medical management, or maybe you might need other sort of perfusion procedures. It depends what. So
I feel like her course is really interesting. It's really nice.
I'm just talking about ECG. It's not that it's just about ECG, guys. Don't get me wrong. I'm talking about ECG because that's the main thing that is the basics of our course.
So what other thing can you talk about that's related to your course apart from ECG?
So pacemaker, we do pacemaker insertion. It's still, the foundation is under ECG, because if you can read ECGs, like you can't read the rhythm and figure out which rhythm require that particular pacemaker. You get me? So, and also, like, if you can read ECGs again, you can do, like, for example, in the cath lab, we can do PCI, which is
no, don't pause. Which is
it's a protein. Really? Oh, no. You know what? My brain is freezing. Do you understand that?
Pause.
Aside ECGs, we perform percutaneous coronary interventions, which are like, it's reperfusion. So we stent patients who
you guys are perfusionists?
Not perfusionists. It's just in the coronary arteries. So
can you tell what perfusionists are, so that people
perfusionists?
Yeah. So that
well, that's a completely different course, but it's kind of related to us as well. So you can do a master's for that if you're interested. That is to do with circulation. So during an intervention, for example, say CABG, which is one of the cardiac interventions that you could do, the perfusionist would be using his tube and his machines to try and circulate blood in the body of the patient whilst they are not responsive at that time. So the anaesthetist tries to cool them off. Kill them. And then in the meantime, to prevent damage in the brain, because it's not receiving any blood. We try to, the perfusionist will be circulating blood around through the feet. So just as the heart would do, but we've made the heart static in order to perform the intervention. So the perfusionist will be doing that manually with his machine. That's what perfusionist.
So that's what perfusionist is, guys. So
but we'll be doing percutaneous coronary intervention, which is whilst the patient is still alive and they're still on, they can see what is going on. The procedure will be putting catheters through their arteries. So it could be a femoral or the brachial arteries, and then we will go through into their coronary arteries and we'll try to open any blockages caused by plaques or deposits. So like maybe a patient who's had like atherosclerosis, they've had MI, which is, well, if I say MI, I'm saying myocardial infarction or something called heart attack. Yeah, easy. Let's make it easy. Heart attack. See a patient having a heart attack, you call the ambulance. Yeah, the ambulance brings this patient to us, and we try to reperfuse them and make sure that the blockage that is causing the heart attack will open the space within the coronary vessel.
So that's like, this will answer like what is your role in the hospital.
Yeah.
So basically this is your role in the hospital.
And I can see like with this, if a patient is having a heart attack, through my ECG I can see and tell you that this patient is gonna have a heart attack.
Again.
No, I can't predict it, but I can see that they're having it at the moment, and we need to do something, or they are gonna have it, because their chances of having, we've got something called ST elevation that we measure on the ECG. That's why I'm saying it's foundation to us. If we know what is right, what is supposed to be normal, anything abnormal, we identify it.
Okay.
So that's how we relate to our diseases.
So you did say that progression is quicker in cardiac physiology. So what I want to know is, what can you progress onto with cardiac physiology? Okay. What other things can you do?
So, as a cardiac physiologist, there are two major branches. You've got the structural side of it, and you've got the electrical side of it. Right. So many people they get chance to train on one, but some people get chance to train on two, and some people get chance to train on everything. It depends on how well you are, what you can do.
So what are the differences?
So the structural part, we've got echocardiography. So it's like the baby scan you do on the belly when mom is pregnant.
Are you guys those people?
We are those people. Yeah. Instead of scanning the belly, we scan the heart. We've got a special probe for the heart, and we can see the heart pumping whilst you are sitting there, and we can interpret it. We can interpret we can take measurements of the dimension, because some people may be having a disease called cardiomyopathy, which is the enlargement of the heart. And we do the electrical side as well, which is to do with pacing. So pacing is where the doctors will insert the pacemaker, and we will be programming it like a computer programmer. Instead of you being, someone will be like, for example, a software programmer. The software has already been developed, but someone will be programming stuff on it. We do that back of the heart, and it's suitable or specific for the particular person who's got that particular pacemaker.
So for the electrical side of it, do you have to do like a master's degree, or is it? Do you guys do it in your 3 years?
We do. No, we don't. We are not allowed to. We learn the electrical side only. That's the only side you can learn. But to be honest, we've learned it, but it's not sufficient to work on your own. You can't work on your own. There is a lot more. So obviously, automatically you do the masters to get that.
Other progressions are there.
So
you become a consultant in that.
Yeah. So you can become a consultant physiologist, and that is more to do with the admin side of like managing your team within the department, and also practicing as a clinical person. So you'll be managing the team like a manager of the department, and also prepare the rota, that sort of thing. That's the admin side. So and then they do the meetings. So I don't really know that level much, because I'm just saying what I see my consultant physiologists do. And then they also do the clinical aspect, like scanning the heart and also doing patient interpretation.
So now she's a graduate, guys. Woo! See who is a graduate from the University of I was about to say Nottingham, from the University of Southampton.
Yeah.
So
say it louder. Say it louder.
From University of Southampton.
That's better.
Once again, I just want to say congratulations
on
finishing your course. You've done it. It's really hard. University, guys. University, it's a scam. But anyways, you did it, and congratulations. So what are you doing now? Are you going to do your masters? Are you working?
I'm gonna start working next week. Okay.
Money.
You choose which route you want to specialize in, and once you start specializing, they will train you. So once you start specializing they'll train you, and you have to sit an exams with one of our accreditation bodies. Once you pass the exams, you become fully qualified in that area, and then you can. That is your masters, literally. So once you pass that exams, that is your masters. You've progressed to it, and that will increase your band as well. That means more money, guys.
So what band do you guys start from?
We start from band 5, and then you work your way up. Alternative route is like we got the STP program, which is the senior training program. You can train as a cardiac physiologist, and that will take you to a band 6 straight up. That's an alternative route, which is performed by the National School of Healthcare Sciences, and yeah, you can progress from there as well. That will take you after whilst you're completing that. That's the master's program again.
Yeah.
You'll be going to university whilst coming to the hospital to work, and you'll be paid for that. Once you finish, there's a chance that you can become a band 7 straight up as well. So many hospitals are recognizing that now in the NHS. Okay, if you really want to go to university and do masters, you can do that. But to be honest, if you look at it, our course is more practical. You need to put your hands on it, because I can study all the theory in my head, but if I don't practice it, it's useless. So you don't really need to, but if you want to get that master's by going to university and paying your 9k plus, you can do that. But then there are alternative routes where you can get paid and get a master's anyway within 3 years.
How was it like to get a job after uni? Was it hard? Was it easy because it was NHS? Was it straight away, or did you have to apply? Did you get help from your university finding a job? How was it like to get a job after this?
So to be honest, if I'm to compare myself to other people studying different courses, especially in this pandemic, mine was very easy to find a job. And I don't think it's just because of the pandemic, but overall, if you even go to the Southampton University website and you Google my course, it says that employment rate is 100%. I've finished uni, I haven't graduated yet, but I've got a job, and I got a job back in June, just to say. And the thing is that don't take it for granted. You have to pass interviews, because they are, as much as they need people, they want people who are qualified and who knows what they're doing. So you'll be competing with other people. Each center is different, their requirement is different, and their policies are different. You have to meet those standards to be employed.
Anyways, guys, thank you, Nettie, for coming on Journey with Keren. Thank you for sharing your experience with us and talking to us about cardiac physiology. To be honest, I thought I knew about cardiac physiology until today. That's when I actually got to find out more about your course. So thank you, and thank you for informing us out there. Hope you guys enjoyed this video. Hope you were informed, and hope it was a nice one. So for now, this is JWK with Nettie. See you guys on the next episode. Don't forget to like, comment, share, and subscribe.
Subscribe. The notification button as well.
Yes, don't forget to